Hi, in this video we are going to talk about chronic bronchitis. What is chronic bronchitis? It's a chronic inflammation of the bronchi of the lungs. It is generally considered one of two forms of chronic obstructive pulmonary disease. Now we are going to watch a video about what normally happens when we breathe.
Normally, as you inhale, air moves freely through your trachea or windpipe, then through large tubes called bronchi, smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries. Then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. Normally, your airways and alveoli are flexible and springy. When you inhale, each air sac inflates like a small balloon. And when you exhale, the sacs deflate.
Now, it's really important to talk about pathophysiology. The poor airflow is the result of breakdown of lung tissue known as emphysema and a small airways disease known as obstructive bronchiolitis. The relative contributions of these two factors vary between people. Some also have a degree of airway hyperresponsiveness to irritants similar to those found in asthma. Narrowing of the airways occurs due to inflammation and scarring within them. This contributes to the inability to breathe out fully. The greatest reduction in airflow occurs when breathing out, as the pressure in the chest is compressing the airways at this time. This can result in more air from the previous breath remaining within the lungs when the next breath is started, resulting in an increase in the total volume of air in the lungs at any given time, a process called hyperinflation or air trapping. Now we are going to talk about mucus production and symptoms.
With chronic bronchitis, damage inside your airways causes the lining to swell, thicken, and make mucus. You develop a persistent cough as your body attempts to get rid of the extra mucus. The symptoms of chronic bronchitis include an ongoing cough that produces a lot of mucus, shortness of breath, and frequent respiratory infections.
Other symptoms may include wheezing, chest pains, fever, fatigue, and malaise. And what are the causes of chronic bronchitis? We have that tobacco smoking is the most common cause. Pneumoconiosis and long-term fume inhalation are other causes. Now we are going to talk about something that is really important, which is treatment.
The most common treatments are quitting smoking, use of inhaled medicines to open your airways and reduce swelling, antibiotics for bronchitis caused by bacterial infection, oxygen therapy for those with advanced COPD and severely low levels of oxygen in their blood, and surgery.
In the next video, we're going to talk about a specific treatment, which is the use of inhalator medicines, which are also called bronchodilators.
Bronchodilators, like Alupint and Proventil, relax the muscles around the bronchial tubes, allowing air to flow unrestricted from the mouth to the lungs. There are three types of prescription bronchodilating drugs: beta-2 agonists, which are available in both short and long-acting forms, anticholinergics, which are short-acting, and theophylline, which is... Since there are such a variety of bronchodilators, each with varying effects, your doctor will take your specific symptoms into account when deciding which medication or combination of medications is best for you. Which are sold under brand names like Pulmicort and meter-dose inhalers, dry powder inhalers, or nebulizers.
Another important treatment that haven't been mentioned is the use of herbal and homeopathic remedies, and the next video is going to show us why. Now we have to talk about the diagnosis. The diagnosis of COPD should be considered in anyone over the age of 35 to 40 who has shortness of breath, a chronic cough, sputum production, or frequent winter colds, and a history of exposure to risk factor for the disease. A spirometry is then used to confirm the diagnosis. And finally, we have prevention. Most cases of COPD are potentially preventable through decreasing exposure to smoke and improved air quality. Annual influenza vaccinations in those with COPD reduce exacerbations, hospitalizations, and death. Pneumococcal vaccination may also be beneficial. And that's all for our video. Thanks for your attention.